Private health insurance. It can be a real pain, but is it worth it for the gain? There are two types of private health insurance, extras cover and hospital cover. Today we're going to look at hospital cover because we're here. When it comes to private hospital cover, the government says
you should buy it.
And they don't just say it, they use the classic carrot and two sticks approach. The first stick is that if you earn over $90,000 and you don't have it, you'll pay a surcharge.
Buy it.
The second stick is lifetime health cover loading. If you get private health insurance after you're 31, you'll pay an extra 2% for every year over 30 that you didn't have it. For instance, if you wait till you're 40, you'll pay an extra 20%. Would you believe I'm 29? The carrot is the fact that private healthcare is subsidised.
Buy it.
And you can get tax breaks for having it depending on your income level. That is not how a carrot works. But despite all this government coaxing, private health insurance is leaving consumers
angry, confused, and I'm concerned that simply shopping around isn't enough to get the best value for money.
Which is damning given it was said by the current minister in charge of health insurance. So how can you make sure that you're getting the right cover? I can't understand why people are angry and confused. They have over 46,000 policies from 34 providers to choose from. So comparing them is simple. Not quite. As a starting point, there are some useful websites. There's the government's privatehealth.gov.au, and Choice has recently undertaken a comprehensive review of healthcare policies that you can sort through. Is that normal?
It gets more manageable once you narrow down options like state, partner, kids, but you also get hit with a list of exclusions which require you to guess your future medical needs.
So, what seems to be the problem with you next year?
I don't know.
I assume you'll be wanting plastic surgery.
Oi!
The list of exclusions grows as you work your way down the 4 levels of private insurance for hospitals. Top level must cover all services where Medicare pays a benefit. Oh. But after that, there are numerous exclusions, which include
Cardiac services, psychiatric services, joint replacements, assisted reproductive services, and pregnancy. Not that I'm going to need that, hey?
I wouldn't be so sure.
Some of the cheaper policies have so many exclusions that, according to Choice, these basic insurance policies are basically useless. Exclusions are not necessarily a bad thing. If you really think you're not going to need a treatment, then having the choice means you can save some money. One checkout viewer complained to us about not having enough choice.
At 65 years of age, having had a hysterectomy, the only way that I could get top cover was if I was covered for IVF and pregnancy.
I don't think you were the right person to play that role.
Oh. How about, at 65?
No! Look, exclusions can save you money, but they can also be very expensive if you think you're covered for something and you're not.
I think you might think you're covered, but you're not.
And health insurance isn't covered by the Australian Consumer Law, so it doesn't have to be fit for purpose, for instance. So make sure you read your standard information statement, which has to be provided with all private health insurance. And that's even after you sign up for a policy, because private health insurers
can change your terms and conditions at any time.
OK, let's cut him open.
Hang on. What's covered if I have to go to hospital? Doctor's bills in hospital. That's good news. I wonder what this see below bit means. I'm sure it'll be fine.
The operation was a great success. I think we got everything.
But you may also have to pay other costs depending upon the doctor chosen, the treatment you're having, or the hospital you go to. Damn it! These extra costs are known as the gap payment. It means that patients have to pay out-of-pocket expenses, even if their policy covers the treatment, and even if they're on the top level of cover.
The gap is one of the most complained about and misunderstood parts of private health insurance, and it works like this.
If you go into a public hospital as a public patient, I have a headache.
Colonoscopy.
Every procedure is on the Medicare schedule of fees, with a corresponding price that the doctor will be paid for performing the operation.
Would you like the footage on DVD?
But if you're a private patient in a public or private hospital, your finest colonoscopy, please, you might think that your private health insurer pays for this. What actually happens is that Medicare pays for 75% of it and your insurer pays for 25%. But that's only for the scheduled Medicare fee.
Now you can pay the remaining $4,000.
Because your doctor can charge more than the Medicare fee, and it doesn't mean your private health insurer will pick up the bill, hence the gap.
But this colonoscopy's in 3D. And I got Martin Scorsese to direct it.
DiCaprio would have been better as this colon, but that's how it is.
In some cases, your private health insurer will have come to an arrangement with a doctor to try and reduce your gap.
How about we lose Scorsese and just stick an iPhone up his butt?
So you end up paying less, but it depends on your health fund, and the differences can be substantial. The AMA noted that for the uncomplicated delivery of a baby, one fund paid out $2,150, while another only paid out $832.
I think your baby's delivery will be complicated.
So beware. The average gap payment in 2013 was over $1,000. But there are some ways that you can try and limit your gap payments. You can compare information statements and see how often policyholders have to pay out-of-pocket expenses. But even then, before you go for an operation, you should ask your doctor and anaesthetist what their fee is and check how much of it your fund will cover. If you think it's too much and it's not elective surgery, you can still register as a public patient. I'm sorry, the gap is just too big.
You're telling me.
Of course, it's all very well to ask these questions when you know you've got an operation coming up. But in an emergency situation, these questions are the last things on your mind. And because most emergency surgery is performed in public hospitals,
If you sign up as a private patient,
you could end up with the same doctor, but paying for something that would have been free if you're a public patient. Staff are meant to inform you and your family if there are any out-of-pocket expenses, so you can make an informed choice.
But if you don't think you were properly informed, then you should contact the private health ombudsman or health department in your state.
It was all a dream. You can choose to face higher bills when you go to hospital in order to have lower monthly premiums on your insurance. As with other insurance, you can reduce your premium by paying a higher excess when you use it. And you can also agree to a co-payment for your hospital fees. Let's just split it. Where you pay a fee per night up to a cap. You have to make the call whether you prefer lower premiums or a lower lump sum if you end up in hospital. It was all a nightmare. Which is not to suggest that private health insurance is all a nightmare. There are definite positives. You get to choose your own doctor. You're gone. You can avoid public hospital waiting lists for elective surgery in most cases. And they can cover a lot of the accommodation expenses associated with private hospitals or private rooms. If you look at your private health insurance, as you regularly should, and realise you have a bad deal, then you can switch. Be careful though, because new policies often have waiting periods.
12 months waiting period for hip surgery.
But I need a new hip right now.
Get out. But if you've already served that waiting period on your old policy, you won't have to serve it on your new one. Although if you're upgrading to something you weren't covered for, apparently I'm going to need pregnancy cover on this one.
That's 12 months also.
You will have to serve that waiting period.
Okay, let's get this baby out.
Sorry, I've got to wait 12 months. Look, private health insurance isn't all bad. It can help save you some tax, it can help you get the doctor or the operation or the hospital that you want. But you really have to know what your policy does and doesn't cover. Because in some cases, it won't insure you against costs so much as opening you up to higher ones.
We were so worried about you.
Thanks, Mum.